Today we are going to learn the carving of maxillary right central incisor. First try to take a block and divide into a crown part and the root part. As we know, the crown part is around 10.5 millimeter. Try to keep it as a 11 millimeter. Take a scale and divide the crown part. First thing is division of the crown part, which is around 11 millimeter. So we have to divide the whole block into a crown which is around 11 millimeters, the root which is around 13 millimeters. Try to keep it as around 15 millimeters. Roughly we had divided the crown into a crown and the root. The next thing is we have to mark the buccal side, lingual side, mesial side and the distal side. So as we know, the buccal side, which is otherwise called as the labial side, so try to keep it as L, mark it as a L. Since we are going to carve the right maxillary central incisor, you should make sure that you should mark your mesial side and distal side properly. But before going into the mesial side and the distal side, the exact opposite side of the labial side is the palatal side. So mark the palatal side also. Try to put as P. As we can see, now we can able to see the P. The second step is very important in carving of a central incisor. That is marking your labial side, palatal side, mesial side and your distal side. The next thing is divide the labial side into 3 equal parts. Okay, 3 equal parts means this part is called as the incisor 1/3, this part is called the middle 1/3, this part is called as the cervical 1/3. So divide the crown into 3 equal parts. As we can see, we have divided the whole crown into 3 equal parts. The next step is you have to carve the labial side and the palatal side. Before carving a labial side and the palatal side, try to draw a midline in the mesial side and the distal side. In the mesial side and the distal side, you draw a exact midline. Why? Because we are going to make sure that the incisal edge is exactly in the center of the block. That's why we are drawing a midline in the mesial side and the distal side. Don't draw it on the labial side and the palatal side. In the labial side and the palatal side, we will never draw a midline. We will be drawing only a midline in the mesial side and the distal side. The next thing is you have to carve the labial side. If you want to carve the labial side, okay, try to keep it on the mesial side or a distal side and try to draw from the middle 1/3 towards the center of the tooth. Okay, a sloping line towards the center of the tooth. As we can see, there is a sloping. Okay, so you try to draw it on the mesial side as well as in the distal side. So the labial side. The next thing is we are going to carve it. So keep the block and slowly carve it. Don't force the carver. Now we can able to see from the middle 1/3 it is sloping towards the center. Okay, similarly on the mesial side, if you see, I had drawn the line and it has moved towards this area. Now what you do is we have to carve the palatal side. The palatal side is concavo-convex. So try to draw on the mesial side and the distal side as concavity. Okay, don't draw it in the straight line. Okay, try to draw it as concave. Okay, similarly on the distal side also I am going to draw it as a concave. Don't draw it as a center straight line. Now what we are going to do is we are going to remove the extra bit of wax. Okay. For carving the lingual side, try to use this part. Okay, this part of the carver, so that you can get the concavity. As you can see, I am using this part of the carver to give it a setup. Don't give too much of concavity in the palatal side. We can finish it at any point. Can you see the concavity? cavity, okay, the concavity on the palatal side, and a straight line on the labial side. So this is the labial side and this is the palatal side. The next step in this is you have to give the lingual constriction, that is the palatal constriction. The palatal side or the lingual side should be converged, which is what is a lingual constriction. So what you have to do is you have to converge the lingual side. The lingual side is always smaller than the labial side. Okay, as you can see from this point, okay, it is sloping towards this. Similarly, I am going to give the even sloping on the other side also. It is called as a lingual convergence. Don't cross the crown part. Okay, you are not supposed to enter into the root part. You should try to keep it only in the crown part. As we can see this, the palatal side. The palatal side is, okay, this is the palatal side. The palatal side is smaller when compared to the labial side. So we have finished almost the carving. The next step is you have to carve the mesial side and the distal side. Okay, the mesial side is, as we say, it is straighter, and the distal side is somewhat convex. Okay, so what you do is take the labial side and draw the mesial side, which is roughly straight, while the distal side is somewhat convex. Now what I am going to do is I am going to carve the mesial side. Okay, I am carving the, as we can see, I have drawn the line and I am maintaining in the same position. Similarly, I am going to carve the distal side too. See, now you have carved the mesial side and the distal side. Okay, the teeth is almost done. The next step is you have to check your labiolingual dimension. The labiolingual dimension is a little bit larger in this condition. You have to reduce it to the proper dimension. So what you do is you try to remove from the cervical 1/3. Evenly reduce on the mesial side and the palatal side. Don't just remove the wax only from the palatal side. Evenly you should remove from the palatal side and your labial side. The next step is, it is almost done except for two things. The mesio-incisal angle should be sharp, the disto-incisal angle should be round. Except for this, everything has been finished in the crown portion. The next thing is we have to carve the root portion. As we know that the dimension for the root is around 13, try to keep it as around 15. First thing is, try to divide the root portion into 3 equal parts. That is the cervical 1/3, middle 1/3 and the apical 1/3. Make sure that you divide on all parts, just like our crown. You can divide into 3 equal parts. What you do is draw a straight line. Okay, draw a straight line to the exact half. From there it should converge. Okay, similarly draw from the midline exactly in the center or in the apical 1/3. Try to convert this area. Similarly, draw the same thing on the palatal side also. So what you do is you try to remove the wax from your mesial side and the distal side. Try to carve the wax, don't chop the wax. and almost. Now what you do is take your mesial side and the distal side. Okay, take the mesial side and draw the same thing. What you do is divide the root into 3 equal parts. Okay, this one is the cervical 1/3, middle 1/3, and the apical 1/3. Try to draw it straight, and the apical 1/3 should be conversion. Draw it and try to convert this. Yeah. So what we are going to do is we are going to remove the lines. Try to carve it, don't chop it. As you can see, we had almost done the tooth. Thing is, we are going to chop the bangs. Exactly, this is what is called as a base. Okay, try to remove the base carefully. Don't break it. Try to remove it very carefully. Give enough bangs just below the apex. So, in case if there is some problem, we can. We have divided it to. We are going to this. Yeah. Almost the root is there. Thing is, the apex is not sharp. So what you are going to do is you are going to try to make the apex somewhat blunted. The other things what you have to see is you can see this line angle. This line angle is sharp. We don't want this sharp line angle. So what you are going to do is we are going to blunt this line angle, or in other words I can use a word called as a rounding of the line angle. Try to round off the line angle. Make sure that the crown and the root are in level with each other. Don't make the root bigger. They should be, first thing is it should be in level with the crown. The next thing is we will be reducing the root. The root should be always smaller in dimension when compared to the not. I'm not talking about the root length. Rather, I'm talking about the width of the root. The width of the root is always smaller when compared to the crown. See this, now it is almost done. So this is the labial aspect. Okay, this is labial aspect. One thing what you are missing is this is the right central incisor. Okay, so this side should be your mesial side. The mesio-incisal angle should be sharper. It should be sharp, and the disto-incisal angle should be rounded. So what I am going to do is this is the disto-incisal angle. I am going to round off this disto-incisal angle, which is very important. Okay, the disto-incisal angle is rounded when compared to the mesio-incisal angle, which should be sharper. Keep in your mind, it should be sharper. This angle should be sharp and this angle should be round. The next thing is what we are going to do is we are going to carve the cervical line. The cervical line is 10.5 millimeter from this point. Okay, from this point it should be 10.5 millimeter, and it is convex. Okay, don't make it as concave. It is, or in other words, I can use the word called as a semi-lunar in shape. Okay, as you can see, this should be semi-lunar. Okay, similarly, the exact opposite side should be your lingual side. The lingual side should be semi-lunar. The next thing is your mesial side and the distal side. Your mesial side should be concave. See, join this mesial labial side and the lingual side. This will be like this. Similarly, you can do it on the other side also. Concave. Okay. The next thing is just below this cervical line, how to reduce the root. What we are going to do is we are trying to reduce, or we are that the root is smaller when compared to the crown. The other thing is, see your incisal edge. The incisal edge is little more thicker, so you can make it little more thinner also. Equally remove on the labial side as well as from your labial side. Once this is done, what we can do is we can carve your lingual fossa. Your lingual fossa in the mandible and the maxillary central incisor is somewhat M-shaped and compared to the lateral incisor, which is V-shaped, and in the mandibular central incisor, it is very, very small. Okay, so this is the lingual fossa, and this is going to be your cingulum. So this is M-shaped. So what we are going to do is we are going to remove a wax just below this M. Okay, so automatically this will become the lingual fossa. But make sure that you don't touch this area. This part is called as a incisal ridge or incisal edge. Don't touch that area. So just below it. We had said is the mesial side is straight, it is somewhat straight, the mesio-incisal angle is sharp, the distal side is convex, and the disto-incisal angle is rounded. The lingual side is smaller when compared to the labial side, and you can see the lingual fossa, which is M-shaped, the root and the cervical. Once I polish it, you can able to see how good this carving look like. It is very simple to carve a maxillary central incisor. This is the polished tool. You can able to see the crown, cervical line, the root. Okay, this is the labial aspect. Mesial side which is straight, distal side which is convex. Mesio-incisal angle is sharper, disto-incisal angle is rounded. And when you go to the lingual side, this part is the cingulum, this part is the lingual fossa. You can see the root. Sometimes the root tip can be tilted towards your distal side. A slight distal tilt can be seen in the distal side also. Okay, so this is your mesial aspect, the labial side which is convex, the lingual side is concavo-convex. You can see the cingulum, this is the root. But make sure that your incisal tip and the root tip should be exactly in the same layer in the mesial side and in your distal side. Try to make it exactly in the same layer. This is the labial side, lingual side. Labial side is convex, lingual side is concavo-convex. And you can see the cervical line, which is concave, mesial on the distal side, and the labial side it is convex or semi-linear.